Coming up on today's Morning Medical Update, how one simple quick test can give you an inside look at your heart health. We'll show you how it works and who should get it. Good morning. It is Thursday, October 27th. I'm Jessica Lovell. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. Many people learn they have heart disease after it's too late. How knowing your cardio calcium score can help you get a better handle on your cardio health. So get your questions sent in to us through the links here on your screen, or you can place them in the chat thread below. We will get to those in just a bit. How many of us really, though, know our risk of heart disease? Today, we are going to show you how to get a better idea of where you stand when it comes to your heart health. It is called a cardio score. Nurse practitioner specialist Shirley Verbenik is joining me here in studio. She works with cardiology patients here at the health system. Good morning to you.
Good morning.
We will have lots of questions. I already have many for you this morning. Jill Chadwick is also going to let us watch her get a test here in just a few minutes. Good morning. How are you?
I'm doing great. I did have a little anxiety last night because I want to get a really good score, although the odds might be a little bit against me, which we'll find out here in a second why.
Okay, well, thanks for letting us get a sneak peek into your doctor's appointment this morning. We're anxious to find out along with you. Shirley, though, I want to start with you about who should get this cardio score.
Really, anybody who has any risk factors for heart disease is a candidate to get the score.
So I want to ask you a few more questions about that because, like, for instance, I don't think I'm at risk. I haven't dived deep into maybe my history or how far back my heart history in my family might go, but I think I live a pretty healthy lifestyle. I don't smoke. I exercise regularly. I think I eat pretty well. Should I still get it?
So you could if you have any concerns about your heart health. But a family history, that could be a mom, a dad, a grandparent, an uncle. If you've ever smoked, if you have any high blood pressure or high cholesterol, you would be a good candidate to get the calcium score.
And what are they exactly looking for? Jill's getting set up and in place, but what is she going to go in and really find out?
So she will find out if there's any hard plaque. There's soft plaque and hard plaque. The calcium score will detect hard plaque. So soft plaque hardens over time.
And you can't get rid of either. Neither are reversible.
Correct. But we can prevent the progression of further plaque growth, which could prevent a heart attack, a blockage.
Okay, so we want to go back out live with Jill. She is joining us with Kay Ness, a cardio score consultant and exercise specialist. So Kay, I know is sitting there with you. Jill, so good morning to both of you. I want to ask Kay though, what does this test actually show? We talked about the hard plaque and the soft plaque that will turn into hard plaque, but what are you really going to be looking for?
So we are measuring the amount of hard calcified plaque in the coronary arteries. So we're actually quantifying, putting a number to that. And then over time, that plaque can build up in the walls of the coronary arteries. When that happens, that can limit blood flow to the heart, but that plaque can also rupture, causing a heart attack potentially. So we take this information and we can decide how aggressive we need to be, the patient and the provider, on lifestyle, treatment, and possibly even more additional testing that might be needed.
Type of moment. So is this what you mean by when we say clogged arteries? Okay.
Yes. Yep.
Clogged arteries. So
That
Jill,
is correct. Yeah.
So Jill, I know we're about ready to get started, but how are you? You said you had a little bit of anxiety last night. I mean, I think anytime we talk about our heart health, I mean, everything starts in the heart. And now you're going to get kind of an inside look at where you stand. So talk to us kind of how you're feeling right now.
Well, I'll tell you why I have anxiety. First of all, I'm very competitive, and as I mentioned before to everybody in the newsroom, and even yesterday when we were broadcasting, that my husband got a really good score, and I'm a little bit older than him. Some people may have say that I robbed the cradle, but that's kind of not in my favor. As you get older, apparently, my percentage of having some kind of plaque is like 42% in that area. I'm in that decade. But hey, we all go there, right? And that's the hope. I'll tell you, my other part of my anxiety is that my grandmother had a heart attack at 35. But I think she might have been of a broken heart. They didn't know that back in that day, but her daughter died, and I think that's what caused it. My other family has had heart problems, but I always said, oh, it was because they smoked, or it was environmental, right? Because they drank or they were on medication that impacted it. So I've always kind of said that's what that problem is. There's one little thing that has me just a little bit nervous, and that's my genetics. As Kay is going to tell you, she's going to share some of my LDL and my good and my bad cholesterol numbers. And you're going to hear that they're not as good as they could be, even though I'm like you, Jess. I think I'm fit, I'm healthy, don't smoke, drink just a tiny bit on the weekends, maybe have a glass of wine, but eat right, exercise. But my genetics may be against me, right?
That is correct.
So does genetics play the bigger, heavier role then, Kay, when it comes to genetics versus that what we think of as a healthy lifestyle?
Genetics do play a piece of the puzzle. I look at it as a puzzle piece. We have things that we can't control and things that we can control. So the genetics is a piece of that puzzle, but we can also help reduce our risk and slow down that progression if one does have plaque, by having the healthy lifestyle, the diet, the exercise, and managing everything else.
We do have some information. We're going to have a Bitly link on the screen so you know where to go to. You can also hover over that QR code for more information about how to sign up to get one, because as Shirley had mentioned, it's not just somebody with a family history or somebody who's overweight or maybe doesn't make the best lifestyle choices, but you say it's really for anyone who just wants to maybe have a better peace of mind, right?
Peace of mind, correct.
Let's talk a little bit about that, and how do we keep from maybe really needing a cardio score? Let's talk about those preventative measures. What do you tell patients?
Well, just to reiterate what Kay had said, being mindful of what you're eating, your exercise habits, or just avoiding being sedentary, not smoking, limiting sugar, limiting salt. Those are all things that we all need to be mindful of preventing most diseases.
So Jill has a good head start
She absolutely
on that,
does.
because I know she walks. Jill, I know you're a big walker. We always think of wine as being good for us, kind of,
In
right?
moderation.
Please give us some good news there, Shirley, right?
Say in moderation.
In moderation.
There could be some benefits.
Of course. And Jill, I know you're good at that. And I want to talk about, because your husband got one, it's got to be also a good peace of mind when your spouse gets a good score too, to know what's going on in your loved ones' bodies as well.
It does, and it's what made me say, I think I want to get one of these, because if anyone were expected to have it, he carries a lot of weight, and he's just a big guy, barrel-chested, a little over 6 foot, and he's always been a little on the what I call plump side. But we love him. He's a big, awesome teddy bear. And he was so proud. And I'd like to ask Kay, just so in case the audience doesn't know, I'm going for a score of 0, which is what my husband got. So I guess I really can't do better, but maybe I could tie him. Tell us a little bit about the scoring, and then we'll maybe head back if it's time.
Yeah, so 0 would mean we found no identifiable calcification. And then the score can go up as high as it needs to, because again, we're just quantifying the amount in each individual person. So it can go into the thousands. But as that score gets higher, your risk of a heart attack and stroke is going to increase. And at a certain point, we're going to want to do additional testing that is going to specifically look for those blockages. So anything usually we're score 400 unless the person is symptomatic or has some other risk factors the doctor might think they need to have, like a nuclear stress test that's going to check for those blockages.
If you were to find a blockage, you said you can test with a nuclear test, but how would they get rid of it if I needed to get rid of it? Can you go in and clean out the pipes?
You can. So I consider this step 1 in the process. And then step 2, if needed, would be the nuclear stress test. That test is designed to catch blockages at a certain point. And then if that test comes back abnormal, then your provider is typically going to want to do a catheterization, and that's where they go in through the wrist or the groin and take a really close look at those coronary arteries to decide, do they need to stent, can we medically manage, or do we need to go in and do bypass surgery? So those decisions are made at that point.
You also give out dietary information, and I know my husband and I, we both love sugar. And is sugar a big no-no? Is it a bozo no-no?
Well, everything in moderation, right? But sugar is an inflammatory, and so all diseases, including coronary artery disease, are going to feed off of that environment. When we put sugar into our body, we cause inflammation, and so we make that process of developing plaque more susceptible because we're creating that environment where it's going to want to stick into those coronary arteries.
Jill, you had the question I had, is how bad is sugar on the heart? I know it's a biggie for me too. So I want to go ahead.
And foods that convert to sugar too. I mean, we love our carbs. I'm telling you, big hot fresh bread, pasta. I mean, all of those things add up, don't they?
They do, and I like to look at using food as medicine. So if we're 80% of the time using food as more of a medicine, because if you think about how we nourish our bodies, that's affecting our mental health, our physical health. It's potentially changing affecting our blood sugar, our blood pressure, our weight. All of these things are directly impacted by what we're putting in our body.
Do you guys want to, I don't know which one of you wants to do it, Kay or back in the studio, but maybe we just tell people what to expect, what's going to happen next to me. Because it's really simple and it's really affordable, which we will tell you.
Yeah. I always tell people this is the easiest test you'll ever take. It's quick, it's painless, you're not going to have to fast or hold medications. You won't need an IV, you're just going to lay on a platform for about 5 minutes in a CT scanner. Your arms will go above your head, you'll get some breathing instructions, and in 5 minutes you're done.
So let's get started, Jill. You have to wait no longer.
Right. I did have to take my earrings out, right? Because you don't want metal, and take my necklace off.
You actually don't need to take your earrings or your watches off. We just need the chest area clear so we can get good pictures of the heart.
Well, see, I didn't read my instructions clearly, so here I am without any jewelry on today. I like to accessorize, so.
I know you do, but Kay said it's the easiest test you'll ever take. It's so easy, you don't have to do anything. So I'm going to let you ladies get started. And Jill, are we going to get to go back with you and see this all come together? Let's do it. Let's get going.
Mm-hmm.
Yeah, lead the way. Oh, yeah, I wanted to say too, I meant to say this at the beginning. We're sitting in a non-clinical space. Kay and I both are fully vaccinated. We went through the process of if we've, felt good, if we've been around anybody with COVID. But now that we're going back into a clinical space, we got to put these back on.
All right, good girl. I like it. So while you're doing that and kind of getting settled, I'm going to get to a couple community questions, Jill, because as you predicted, we are going to have several. So let's get to those. And Shirley, I'm going to give them to you. Marcia has a question. Do you need a physician's referral to get this test? Can you refer yourself?
You can self-refer if you are at least 40 years old and have one risk factor. It is always a good idea if you're unsure to speak with your healthcare provider.
What's the cost? Does Medicare and other insurance cover the cost?
It's not covered, but it's less than what most copays would be. It's $45.
That's pretty inexpensive.
Very,
because
right.
That's what you're right. You might pay more of that.
You might pay more for a copay.
And a copay.
Right.
As they're walking back to get their score, get the test going, something you and I were talking about, because I said, should everyone get it? And there's a difference between everyone should and everyone can get it, because you didn't want to concern everybody that this is something everybody needs to run out and get. So to help us kind of clarify what you meant.
Because most disease, unless you have a family history of premature heart disease, being 40 or older is better to wait till that time. So if you're 20 or 30 and you have a chest pain, this is not the first test you want to have done.
There's other things to do.
Right.
So then, so let's let's see what they're doing in here real quick, and then I've got a couple more questions coming in. Can we see what Jill's up to? I think she's about ready to lay down.
Let's go ahead and get you on the table. This is a really quick, easy scan. You'll be in my room
Okay,
about
so she's
3
going to lay
4
down.
minutes.
They're giving her some instructions. Tell us a little bit about. Shirley, I'm going to let you kind of tell us what they're having her do.
No, it's not a problem at all.
They're just going to have her lay on the platform that Kay was talking about, and you can see the CT scanner is open. So if somebody might
Head
have
here,
some
feet down that way.
claustrophobia, you're not fully enclosed like an MRI.
Okay, that's what I was going to ask. You're just going to go, and does she have to sit still?
She will have to lay still, and they'll ask her to hold her breath
Love
at
it.
certain times, but not for very long.
Some cardiac leads, just like you probably
I just kind of want to hear in.
placing those on your chest. So we'll kind of reach a little bit underneath your shirt and over top if that's fine
They're
with
putting
you. You don't have to move around too much.
Patches for the
So they'll put the 3 patches,
Absolutely. Ankles
and what is
can
that?
stay
That's so that
crossed,
the
or you
scanner
come
can read it.
forward, you
monitoring
like
her
something underneath
heart
the legs.
rhythm.
Okay.
All right, here come the stickers. We're going to put 2 up here and 2 down here.
So Jill's getting her
Okay,
cardio
yeah,
score
this is
right
the
now. We're going to
purple
find
shirt.
out.
Yes,
That's how
this
quickly this goes
is.
and how easy it is. And we have information
Have
on
you
the
ever
screen.
had a
You can
CT?
hover over the QR code or hit
Okay.
that bit.ly
This
link.
is probably the
for more
quickest,
information,
easiest
but
one
she's
you'll
gonna be going
ever
in.
have. There's simply breathing instructions.
Okay.
So
Lift your
it'll
shirt up a
be
little bit
just a
here.
tiny bit right there.
Oh, those are cool.
I know, I'm so sorry. Bring your arms up over your head, rest them there. We're
Everything
gonna
feel
go ahead and check
okay?
and make sure that everything up here is picking up correctly, okay?
And Brenda's going to give you your breathing instructions.
Thank you. So what you'll hear is the machine has an automated voice. It's going to ask you to take breaths in. It will have you blow them out. Do the best you can. They're not too long, but if you feel like you can't hold your breath the entire time, gently blow it out or gently breathe in. Won't mess anything up. It's a very relaxed exam. Any questions for me about it?
No, this is good.
All right. So we will get you in and out here in a few minutes, and then Kay, our educator, does go through the preliminary results with you. So as soon as we're done, we'll just get you put back together. You'll go to the consult room with her, and she'll give you a preliminary idea of kind of what to expect and more information about it.
Thumbs up.
All right. You don't go in too far either. You just go into about there. And all I ask is that you hold still. Any final questions? You're doing well?
I'm good.
Excellent. Let's get started.
All right, so while they're doing, how long will this take for the scan to actually read?
5 minutes.
5 minutes to read.
Yes.
Okay, that gives me a chance to get to a couple of questions. We talked about smoking. Erin wants to know, does smoking, how much does, I mean, we know smoking's bad, no question about that, but how does it cause the buildup? And how important is quitting smoking to stopping the progression of that plaque buildup?
I think it's the biggest risk factor that we can control, smoking. So we can reduce our risk of having a heart attack by 80% if you quit smoking. So that's a huge deal. Smoking causes inflammation inside the blood vessel, so that can cause plaque to build up easier. It hardens the vessel, which also causes plaque buildup, and it can cause plaque rupture because of that inflammation.
So we talk about some of those risk factors, and Jill had mentioned off the top, she's kind of having a healthy, no pun intended, healthy competition with her husband who had a really low cardio score. I
Right.
think a 0. I think he had a really low cardio score. So she went in to get one, but she kind of said she might fall into that age group. So why might someone in her husband's age, in his mid to late 50s, and someone in their 60s do that? Just because of age?
Well, for women being postmenopausal, she said, you know, when you get to a certain age, your risks do go up. So the longer we're postmenopausal, the higher our risks will go. But this is where it will be interesting because Jill said her husband is a little plump and doesn't, you know, eat quite as healthy as she thinks that, you know, as she does. And she's thin and fit and exercises and eats right and doesn't smoke, but she has that family history.
So it'll
she
be
may
interesting
have-
to see.
Right. So you can never tell by the outside what is happening on the inside. So again, you have to look at all of your risks, discuss those, you know, with your physician and decide if this is the right test to do.
And as you said, yes, get one if you have those risk factors. You can get one if you're interested to know,
Yes.
and that's good. $45 to get that test. You can click on the information right there on your screen for more information how to do that. Jill's doing some breathing, I guess, right now, so that they can do that scan read.
So when they
The
capture
breathing.
the picture,
Okay. She
so
said
the
not too-
lungs aren't getting in the
To
way.
be finished, I'm going to give your pictures a final quality check,
Okay, almost
and
done.
then we'll move you out of the scanner and help you get ready to go back to the consult room. Just one moment.
While we're waiting for that one moment, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. He's joining us this morning with our COVID count and headlines this morning. Good morning to you.
Yeah, hi.
Hi.
Right now in the hospital, we have 29 active infections with 5 in the ICU, 1 on the ventilator, still 25 in that recovery period as well. So still fairly high. Hopefully we can go down again soon and waiting for this possible surge with influenza and COVID.
Ebola question for you this morning. Pharmaceutical giant Merck has up to 100,000 doses of an experimental vaccine of Ebola that they're going to donate. They're going to donate them for testing in Uganda's outbreak. How important and effective will that be?
So how important? It's going to be vitally important, I believe. This was an Ebola vaccine that was initially worked on and investigated in the early 2010s, around 2010 to 2014. It's very important because we do have an Ebola vaccine and some Ebola treatment. However, that is for the Ebola Zaire strain. And that is different than the Ebola strain that is causing the outbreak in Uganda, which is the Ebola Sudan strain. And these are different strains. I know we used to talk about strains for the SARS-CoV-2 variants. Those are not strains. These are actually different strains of viruses, so we need new and different therapeutics. So I think this will be very important. It was tested in non-human primates, and it did show protection against disease when those primates were challenged with Ebola Sudan virus. This will be very helpful and especially, very needed for that area. So very good news.
Hang tight, because I do have a community question, but if you're joining us, Jill just received her cardio score. It took about, I think it was almost even less than 5 minutes, Shirley.
Pretty quick.
So she's heading back, and we're going to get those results here in real time in just a few moments. Hi, Jill. How are you? That was easy.
Hi, good. Good. It went great.
Okay.
They
well,
really walk you through it. It's really easy.
Okay. So how soon will you get those numbers?
Well, she's going to grade me, and you got to enter it into the computer.
about 5
so
minutes.
5 minutes?
All right, so we're going to check back because I've got a couple
But
of
you-
community questions. So hang tight. We'll get back with you in here just a moment. We are excited to hear. Okay, so Dr. Hawkinson, I have a question. Sarah wants to know, has there been any word as when the bivalent booster for 6 months and older will be available?
No word yet. I know they are investigating it, hopefully soon, obviously, but no specific word for that bivalent booster just yet for that age group.
And someone else had a similar question, which was why is it taking so long?
Again, I think you need to get the data. We knew that with the children there were less trial subjects and enrolling and things like that. They also want to make sure they have the correct data analysis, and this is the thing that we have seen since the beginning with these vaccines in regards to pediatrics and especially those younger ages. So again, we do anticipate and believe it, and so far all of the data would suggest that it's safe. We want to also make sure that there is efficacy there for that.
Okay, Rita has a question. How long after cataract surgery before I should get the flu shot? Any reason to wait?
There's no reason to wait. You could probably actually get the flu vaccine while you're getting the surgery if they were inclined to do so.
There you go.
It should not affect anything as far as the immunologic response to the vaccine. I am not an ophthalmologist, but I don't believe it would affect the surgery necessarily either. So, but you can, obviously you're not going to get it while you're in surgery, but go ahead, you can certainly get it anytime your ophthalmologist clears you to be out in in the community after recovering from that surgery.
Okay, I've got a few more questions I want to get to because I've had to push them off for the last couple of days. So I want to get to that. Catherine wants to know, is it necessary to wait 90 days after infection to get bivalent booster shots?
You know, it's not necessary, but you know, we know that there is that concern that people don't, number one, want to be getting more doses of this vaccine. This was just something that was allowed or under some guidance with the CDC saying you are able to wait because you do have that natural boost of immunity when you have the infection. Again, not only to spike, but those other viral proteins. So it's certainly reasonable to wait to get that bivalent booster.
Isaac says, in regards to across the board or universal vaccines that cover all COVID variants, what's the latest you've heard about them? He said he hasn't heard much about them. Is that something that's in the works? What do we know?
Yeah, I mean, they are investigating. They're trying to investigate a pan-influenza vaccine. They are also trying to investigate a pan-sarbecovirus vaccine. And sarbecovirus is the broader term for what we have seen with SARS-CoV-2 and SARS-CoV-1, those types of viruses, but also just a pan-coronavirus vaccine. So these things are being evaluated. It does take time. Again, we've been very lucky with developing such a safe and efficacious vaccine to SARS-CoV-2. But we know we don't necessarily have the same efficacy in something like a flu vaccine. And again, we know RSV vaccine has been in the works for 40 to 50 years and still haven't found anything. So yes, those things are being investigated. It would be good to develop a pan-coronavirus vaccine. Hopefully with this new mRNA technology or even some other older technologies, we can develop those.
And just lastly, Janet wants to know, is the new nasal vaccination that was developed a live vaccine?
I believe it was an adenovirus vectored vaccine, so it was not a live vaccine from what I understand.
All right, Jill, how you doing?
I'm doing good. I'm waiting to get my graded paper. You know
Yes.
that. You remember that.
I do, from a long time ago. So tell us a little bit, for those who might have been joining us, you just got your cardio score, it took less than 5 minutes. We're waiting to get the results, but tell everyone kind of the fun story about why, tell us a little bit about that healthy competition going on between you and your husband, Darren, and why you wanted to get it, a little bit about your family history.
So Darren is 6 years younger than I am. He's in his 50s. I'll let you guys do the math. You just make it low. And when he did his cardio score, because he was just getting a routine checkup, and that was one of the things that the doctors recommended for him, his cholesterol numbers are fine, but they just wanted to do a thorough check because he's this big barrel-chested guy. And turns out he's really healthy. And he got a 0, which is low as you can go. And so he was very excited. I was excited for him too. And then that made me think, oh, I wonder if I ought to get it. We do have a little bit of history of maybe some genetics that are running against me and family heart history where they've had problems. But I've always said it was environmental. I don't smoke. I only have a glass of wine, maybe 2 on the weekend. I try to eat right. I try to walk. So we're going to see. She's standing in the door, so I think she has my scores.
Okay.
Keep your fingers
Okay.
crossed.
Well, fingers are crossed because you know I'm going to be lining up doing it too. And just while she's sitting down getting ready to deliver the news, does 0 score mean you have 0 buildup?
Calcified hard.
Hard. Okay.
It won't show soft.
Doesn't show soft because soft will turn into hard.
Correct. But at a certain age, you know, it's not going to be premature. It will harden. They say every 4 to 5 years you can get a calcium score. So that's about how long it takes for soft plaque to harden.
Okay. Jill, Kay, what are the results?
Yeah, I'm ready. She didn't want me to cheat. I'm trying to peek over. So how'd I do?
Well, so we do consider this a preliminary report. A radiologist or cardiologist will still take a look at all of these images because we did do a CT of the chest. So there are sometimes we find some incidental findings because we do see parts of the liver or the lungs. So that'll be in your MyChart and to your provider. It usually takes about 24 to 48 hours for that to happen. Okay? But your calcium score, which is why you're here, so we evaluated those coronary arteries looking for that hard calcified plaque. Again, we call this your calcium score. So we total all those up. Your score is a 0.
I was so hoping because my odds were against me because of my age. Tell them. This is what she told me. She was trying to temper my expectations. Wait till I call my husband. This is going to be so great.
That's all you're doing this
I
for,
almost
I
want to
know.
call him now.
So what does this really mean, Kay, as far as next steps for a patient? They get this, what seems like good news. Do they need to get retested in 5 years?
Yep, and we're going to go through all of that. I give everybody a report that is going to outline everything that we're going to talk about, so you'll have all the information here to take with you. So this is how we score. So again, a 0 means that we found nothing, 1 to 10 is minimal, 11 to 100 is mild, 101 to 400 is moderate. Anything over 400 is considered a significant amount of hard plaque.
Glad I didn't get that.
Yeah. And as we said, the higher the score, the higher the risk of a cardiac event or stroke. And also,
It's probably too late now, right?
right.
Yeah.
And as we mentioned, once you have a score, you can't go backwards. So we would work and be aggressive, and we'll talk more about those things too coming up on how to keep it as stable as possible. So this is a great and ideal place to start, is at a 0.
Thank you. But you also had mentioned that my cholesterol numbers were not
Yep.
good. Are you going to get to that?
I am.
Oh,
I
here we
am.
go.
Well,
So demographically, and we talked about how we compare your score to other women your age, and we had kind of talked about that off camera. So we want to see where you stand demographically, and that's where we turn here. So 43% of women your age have a score, and as we get older, closer to that 65, that probability is going to keep increasing. So your score of 0 is putting you in that 0th percentile, which is the best percentile, again, to start out at.
That's awesome.
Okay? Now, as we mentioned, we want to keep that 0. We want to stay at that 0. So even if someone were to have a high score, these same recommendations are going to apply to them too, because once you have that score, we want to keep this as stable, as slow growing as possible. But by having that score, it helps determine how aggressive, again, you and your provider need to be. But for you to keep that 0, to stay at that 0, a heart-healthy diet, of course, and our general recommendation is a whole foods-based Mediterranean-style diet, so lean protein, healthy fats, and good quality carbohydrates. That
I don't see sugar on the list
I
here.
know. We did leave that part off intentionally.
You know what? I'm happy. I'm very happy. This is good news.
And then getting exercise, 150 minutes of activity a week, keeping all those numbers at target. So this is where the cholesterol comes in, the blood pressure, blood sugar, weight. So for you, with your LDL, which is the bad cholesterol, I consider that the quarterback of this process. So doctors really are going to want to keep that at goal as much as possible and think about it as primary prevention. We don't know if this will affect you or not, but it's certainly something that we would want to recommend that you keep at 100 or less for you.
And my score is?
And yours at 145.
Yeah, see that thing? It's just been creeping up.
Yeah.
And I can't do a darn thing about it, I
Yeah.
don't think.
And there are those things that we cannot control, and genetics is one of them, and that can affect your cholesterol numbers too. Many people have a family history of high cholesterol and have problems keeping it at goal,
Okay.
despite lifestyle.
Well, give me a high five. I'm feeling good.
Jill, you did great.
And
I
then
have to-
also,
Okay.
yeah. And then stress and sleep are also recommended to keep this at a 0. Avoid tobacco, excess alcohol.
Okay.
And then because you're at a 0, we just recommend coming back in about 5 years. If you have a score, we would recommend 3 to 5 years.
Okay. I'm going to put it in my calendar.
Do it.
Jess?
Okay, so Jill, I had to tell you, I had not heard of this score before you told me you were going to go get yours done after Darren had his done. But what I am glad to tell you is that many of our female viewers have had theirs done, and they're sharing their scores today with us. So I think that's really fantastic. Kathy says she got her first
power
cardio.
to the sisterhood.
Right, it is. Kathy got her first one at 50, then 60, then 65. She's still less than a 1. And Kathy said, odds were against me too, Jill, but still a 0 for her. So you're right. I love that women, we know that heart disease affects women. It's the #1 killer. So to know that people know about this, and if you are just learning about it like I was, click on that link there on your screen or go to the QR code for more information. Jill, I'm really excited. You know, I'm gonna jump in there and jump in there next and see if I can get a 0 right along with you. So I want to stay with you and get some final thoughts about from you and Kay about what you both want us to know today.
Okay. Final thoughts right now? You go ahead and go.
My final thought is, I think this is obviously a very valuable test. We've really caught a lot of heart disease at various stages and really helped people get the treatment and further testing they need, but also that a large percentage of cardiovascular disease is preventable. And so I think this really helps people get motivated to either stay healthier or get healthier. So that's my final thought.
And I guess mine would be, thanks to all the sisters out there that are getting this test. Now take your husbands and your sons and, well, yeah, if they're in their 40s or older, and get it done. And I'm going to celebrate today with carrots.
Carrots and another walk.
But
carrots.
They will have carrots. And then a big long walk.
Take a good old long walk. It's paying off, Jill. Thanks for doing that for us today and walking through. And Shirley, certainly she was showing us how quick and how easy it is. Okay. So final thoughts from you today.
Well, I want to tell Jill she can do something about her cholesterol just because it may be higher because of genetics. But you can come see me. I will help get that LDL down.
Okay.
Okay.
We're sending you on. You've been referred to Shirley. All right, Shirley, thank you so much for your info. Dr. Hawkins, some final thoughts today.
Again, I think we've kind of really been harping and continuing to endorse preventive measures, and it's really important. It's important for everybody to have access to these services and talk with your family, your loved ones, your friends to do these preventive services. Obviously, all of these cancer screenings, the coronary artery screenings, all of those things in the future will continue to save and give you quality of life, and of course, those preventive measures such as vaccination.
And while we are on this topic, All Things Heart is coming up at 10 a.m. Alexis Del Cid joins us now with a preview. Good morning.
Good morning, Jess. We have the story of a Vietnam veteran who has survived his share of dangerous situations.
I was on a minesweeper, and then on the last 2 years, I was on a nuclear sub repair ship.
But decades after returning home, he never dreamt the most dangerous situation of all would be happening inside his own body. The Topeka man noticed a few years ago it was getting tougher for him to enjoy his everyday activities. He had a tightness and a pain in his chest that got so bad he could barely climb the stairs in his house. And you can see where this wound up. Finally, doctors at the VA told him he needed a life-saving surgery. That's how he wound up here at the University of Kansas Health System, where our cardiology team did just that. We're going to talk to Gary about his journey and the surgeon who saved him coming up at 10 a.m. So bring your questions.
Yeah, it sounds like he has quite a story. Alexis, thank you. We'll see you here in about an hour and a half. Thank you so much for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Have a great day, and we'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Local news recently broke the sad news of Curtis the gorilla, his health problems, and medical experts who came together to try and save him. I'm Jessica Lovell. That group included urology surgeons from the University of Kansas Health System. Join us Friday as we go behind the scenes to share Curtis's story and hear from the medical team who helped add months to his life, came together to help this beloved animal at the Kansas City Zoo. See you Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.